microphone isn't working. So, hi, our next speaker is Dr. Ben Poulose. Where should I submit my manuscript, and what happens after I submit?
Thanks, Karen. I appreciate the opportunity to present today. So, you've presented your manuscript, you've presented your paper as Ray has nicely outlined. You've prepared your manuscript as Dave so eloquently put. And so now it comes time to decide where exactly are you going to submit that manuscript and what happens after that. You know, most of us kind of think it kind of goes into a black hole, gets through this machinery, and then kind of a decision is automatically spat out to you. But a lot of it, there's a lot of work that goes into what happens after you submit your manuscript, and thought it would be useful to kind of outline that a little bit. These are my disclosures. So a lot of what I'm going to tell you is my own personal bias. There are several ways of kind of coming to these same conclusions. And I think each one of us who are on the faculty here have come to determine what's worked for us in the past. So the way I think about where I submit a manuscript, I kind of think about it on a couple of axes here, if you will. So if you look at where you can possibly submit a manuscript, I think you can look at it in terms of generalizability as far as kind of the applicability to particular different medical societies. On the left-hand side here, we have kind of the least generalizable, most specialty specific, and on the screen right, the most generalizable journals. And then the strength of the work kind of on this y-axis here. So if you kind of put journals in this discussion, we have journals like Nature, Science, New England Journal of Medicine, and JAMA, which tend to be generalizable, really kind of generalizable to a wider medical audience, and also very high in their strength of work. Our surgical journals, by nature, are more specific to what we do on a day-to-day basis. And then we have the other journals that, again, may not have as much strength of work, and also it's worth noting what open access journals are, and we'll talk a little bit about what that means and why open access journals in general have been met with a lot of caution in the submissions to those particular entities. So how do you determine the strength of your work? So you've taken all this time and effort and money and performed a study, you've presented it, and so how do you determine where along that continuum of the strength of work you kind of target things? In general, this goes back to the levels of evidence, and this is kind of summarized here. Level 1, we traditionally think about as a randomized controlled trial. Level 2, a cohort study. Prospectively obtained data tends to be a little bit more inferentially valid than retrospective data. Level 3 are case control studies, and then case reports, and finally, for completion's sake, expert opinion. So this kind of gives you a rough guideline of where in your continuum, you know, is the strength of your work. The majority of what we do in surgical sciences tends to be kind of level 2 studies, and even within that category, there's a big spectrum of the strength of work itself. So as far as generalizability is concerned, the things I ask myself is, does this appeal to a non-surgical yet medical audience? And if the answer to that is yes, and you have a pretty heavy-hitting study, I think it's important that you get respected colleagues who are non-surgeons to actually review your manuscript and see, hey, is this something that would be suitable for a general high-impact journal like JAMA or New England Journal or New England Journal of Medicine? Because certainly it's worth aiming high, but still being realistic about what your submissions are. I think it's very important to skim the articles and read the articles that have been recently published in that particular journal, especially if you're going towards the higher impact journals. Really look at the study design, the populations, and the methods used. Journals will tend to kind of cluster their methods around common themes, and then if you fall really outside of that, it might not be as an attractive manuscript for that particular journal. Some other tips, very well worth contacting the journal editor to assess suitability if you have any question about the suitability of your manuscript for that particular journal. Very simple thing, read the guidelines for the authors. I cannot tell you, this gets just ignored so many times. We use the formula that was so well presented, but other individual journals will have their own particular requirements. Read the guidelines and stick to them for that particular journal. Again, aim high, but you also have to be realistic. Open access journals tend to be journals where if you essentially pay a sum of money, you can essentially get it published. This is really obviously to be frowned upon, and just a significant word of caution goes when you are submitting to open access journals. Now, there's a caveat to this, and that is, there are open access journals that actually have a pretty wide readership, but just you have to be careful when you're dealing in this particular type of submission. So overall, what are your goals? Are your goals to publish a whole lot of papers, or are your goals to publish quality papers? All of us in the room would like to do, some of both, or ideally both at the same time, but realistically, you fall kind of somewhere in this continuum. My rule of thumb is if you can publish a single paper of high quality, that equals many other papers of lesser quality. So I think the goal should always be, in my mind, to kind of publish a paper that is of very high quality. When you submit, a cover letter is something that is required, but you can use this to your advantage. Obviously, introduce yourself. It doesn't have to be 3 pages. It should be just basically a few lines. One of the most important things is if your manuscript or work is associated with the presentation, list that in the cover letter. And also, the decision about where you submit your manuscript should be fairly easy. If you're submitting it to a national meeting that's associated with a particular manuscript, there have been several instances where the expectation for a presentation to then be submitted as a manuscript for the associated journal was not met. And that you want to, again, be very careful about. If you intend to do that, obviously have discussions with the society. If you think you are doing what's called salami slicing, you really want to list the reference for the other articles. So you have to, first of all, just kind of a definition of what that means. What that means is you have a body of data, and you and your research group think to yourself, okay, this is great stuff. I can probably get 10 papers out of these 50 patients that I've looked at a particular research question. The temptation is certainly there to do that. Again, the goal is to get a single well-designed study published, not necessarily 10 papers. And if you look at how editors and editorial groups really they get evaluated on avoiding just that problem. So if there's any insinuation of this is happening, in other words, you're submitting 20 papers all based on 50 of the same patients, not only is that frowned upon, it's kind of a bad judgment for editors to kind of accept that process. So just to kind of keep things safe, when you submit your paper, if it is using the same body of work, and there are legitimate ways of doing that, be upfront about it. If something has been published from those 50 patients before, just list the reference so an immediate decision can be made. I think this is one of the most important things. If there is any option to select reviewers for your manuscript, exercise that option. I couldn't understand why you wouldn't want to do that. Certainly, peers in your field can be helpful, and provide the information to the editors as far as how to contact them. So, okay, so you've submitted the manuscript. Now what happens? Typically, it goes to the editorial office. There's a completeness review that occurs, and there's a quick editorial decision that's made. Is the manuscript in the ballpark target of the readership material of the particular manuscript? And that decision can be made very quickly, usually not in your favor, and that's okay. And then the peer review, if it passes that quick editorial review, the peer review process then starts. And this varies in time for completion based on the manuscript and based on availability of colleagues around the world. And then a final editorial decision is made, typically to accept, reject, or revise a manuscript. So for the quick editor review, if you get a no, I wouldn't necessarily argue with this decision. Remember, you just got to move on, accept your losses, and continue on. These are leaders in surgery. You wouldn't necessarily argue with them in face to face, and I certainly wouldn't argue with them kind of in this exchange as far as an editorial decision to reject your manuscript. So what if you get an acceptance? Perfect, great, they love you. Get the proofs back in a timely fashion. There's a lot of pressure on manuscripts to really kind of turn these around quickly, so be very good about getting the proofs back in a couple of days at most. And what you'll do typically is just look for typographical errors, check degrees, and that sort of thing. So what if you get a rejection? Certainly the wheels haven't fallen off your whole bus here. I think there's a great deal you can learn from a rejection from a manuscript submission. You swallow your pride, you move on, but couple rules here. I wouldn't necessarily submit to the same journal unless it's clearly a salvageable situation. Would very much urge you to submit to another journal, but really take into the considerations of the feedback that was given to you in the peer review process. Because a lot of times the folks who are reviewing it for the other journals may be, in communication with the folks who reviewed it the first time, and if there's really been no change, then you haven't really done much and taken much information from that process to make it a better submission. I think the generalizability issue is usually not that malleable, but you can certainly make your manuscript a little bit more strong by taking these comments to heart and implementing them. So what about revisions? Certainly, revising a manuscript tends to be one of the most difficult jobs you can do, and it's pretty onerous. But I think this is where the majority of us have successful submissions. We go through the whole revision process. So basically, the thought is that, yes, the editor and the peer reviewers were interested, but something needs to be done. Either you need more data, you need to modify your wording or the emphasis of the manuscript as well. The response letter here is key, and arguably you should spend as much time with this as possible. And you have to be very specific. You want to answer each point brought up by the reviewers. I would avoid grouping the responses into themes. That's the easy thing to do. I think when I'm reviewing these type of things, especially reviews, I almost expect a point-to-point review of each one of the responses put forth by the reviewers. And so each point should really be accompanied with an explanation in the letter and a change in manuscript. If you don't do those two things, especially the change in manuscript, you really need to kind of justify why that was the fact. And that's okay. You can certainly respond to, if you disagree with a particular point from a reviewer, you can respond to that reviewer in that fashion, but you just have to justify it. So in conclusion, I think, you got to carefully consider the content of the manuscript and the strength of the work, figure out where you want to lie along this continuum of generalizability, be accepting of rejections, but take that information and try to make it a better submission. Very much as we talked earlier about in the grant submission process, you've got to be persistent. Work with the revisions, learn from these processes to make it better. Have others review your submissions beforehand and also after a revision has been done. And always suggest reviewers when able. Thank you.